Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Let's go.
Health matters to me.
Come on, get up, cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, though. Positive attitudes, behavior, that's a lifelong dream goal.
Health matters to me.
Yeah, health matters and we're here to help you become the better you, to be the best you, the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.
Hi, good morning, everyone. I'm Jackie.
And Coach Patrick.
And welcome to Health Matters Live podcast, where your health matters.
That's right. We want you to join us right here every Saturday at 9 a.m. as we bring you relevant information pertaining to your health and well-being. We'll have healthcare professionals and other professionals come on the show to assist us in helping you to be the best you that you can be as it pertains to your health and wellness.
So, guys, you already know what to do. Go ahead on Facebook and like our page, Get Fit with Jackie Fitness, and subscribe to our channel at Health Matters Jackie and Coach.
Yep. This is a brand new month, Jackie.
And it is the day the Lord has made.
I mean, the third month in the first quarter.
I know, right?
Year.
I know. And it's like, my goodness, we're already in, guys, we are already in March. Can y'all believe that?
Tax
The
time.
third month. Yeah,
So
absolutely.
you could be late on your taxes if you ain't done them already.
Right. But I'm saying the third month of March, guys.
Third
I mean,
month
the
of
third
the year.
of the year. It's
Yeah.
March. It is March. And so time waits for no one, guys. It
Right.
doesn't wait for anyone. So, guys, use this time wisely, guys.
right.
Use it wisely. Do the things that you are purpose driven and what God has called you to do, because time is precious.
Of the essence.
It is very precious. So make
So-
sure you're doing the things that impacting people's lives and building your community. Just don't worry about what everybody else not doing, as long as you doing what you are supposed to do, and that what matters.
That's what matters. All right. So this
Absolutely.
is a new month, the month of March. Happy birthday to everyone that's celebrating a birthday in this great month of March. Our grandson, Jeremiah, he's celebrating a
Yes.
7th birthday this month.
I know he gonna be 7 years old. My
Big boy.
he's part of J My Jans. That's
Big
my
boy.
Jans, and I call him my J My Jans because it's Jeremiah, Aya, and Noah.
Yeah.
So Jeremiah gonna be 7 years.
7 years
Oh,
old.
OMG!
And our
Yes.
goddaughter, Sarah, she's celebrating a birthday this month.
Yes.
So happy birthday to
Happy
you, Sarah. I think they're still
birthday.
in North Carolina, right?
Febby. I think Dad retired. Yeah, I think
Yeah.
Dad is retired already. But yeah, happy birthday to
Happy
you. And it's some
birthday.
more happy birthday. So if you have a relatives or someone that would you like to shout out happy birthday, gosh, you can just go ahead and put it in the chat, or you could give us a call at 706 at 592-6682.
88.
8862. And say, I just want to say happy birthday. Happy birthday to
everybody.
someone. So, guys, yes, happy
Right.
born day.
Enjoy your birthday.
Right.
Celebrate yourself.
Always celebrate yourself. Yes.
And those that are celebrating anniversaries, however you did it, tried to not jump the broom, guess what? You did it. You're in it. You're in it to win it. You're in it forever. And as you become one, continue to build memories, continue to build on your love, continue to build on your friendship, and continue to just make memories. Enjoy yourself, celebrate yourself. Happy anniversary and happy birthday.
Coach, my brother, 2 more birthdays. How did I forget my siblings? My brother Robert, one of my eldest brothers. Happy
Okay.
birthday
Happy
to
birthday,
you.
brother-in-law.
And my niece Artisha.
Happy birthday.
She's in Atlanta.
Artisha. Okay, I'll call her Artisha. I'm not used to calling her Artisha. But okay.
Happy
Artisha.
birthday to you. Happy birthday to you. So, and
Awesome.
my Aunt Teresa that lived to 102, she was born on leap year.
Okay.
So she had a birthday. So
Mhm.
yes. So a lot of birthdays. So yeah, we're excited. So we're
That's right.
excited.
That's
Yeah.
right. We want to go ahead and acknowledge our sponsor, Dr. Dan Jolich of Aiken Chiropractic. Listen, when your spine is aligned, your body is too. Aiken Chiropractic is located at 425 Lowen Street, Northwest in Aiken, South Carolina. Their number, if you'd like to get an appointment, is 803 641 9191. Their website is www.aikenchiropractic.com. To be a sponsor, a partner, or a friend of the Help Matters broadcast, you can call 706-592-8862. We would love for you to partner with us and help us do what we do every Saturday right here at 9 a.m.
All right, guys, we have a special guest in the studio with us today. But first, you know what that is. That is our Help Matters Happening tune. That is when we take a moment to bring you information that is relevant for your health and well being.
All right, Jackie. Well, today our Help Matters Happening is benefits to consuming local honey and supporting local bee farms. Why is that? Because we're moving into March, just like we've been talking about. So guess what? Pollen, everything's going to start turning green on you, and them allergies going to start popping up. But we just wanted to share this information with you. Consuming local honey every morning and every evening helps with seasonal allergies. Local beekeeper Stephanie Scott with Scott Family Farm in Burke County explain how the honeybee is important to Georgia, not only on a state level with agriculture, but also on a national level with imports and exports out of Savannah. If we lost the honeybee, it's a huge impact and could actually cripple our state and the United States, said Stephanie Scott. A few things people can do to help on a local level is to plant specific fertilizer, plant flowers and trees, and be gentle with hives, seeking out a removal company that specializes with honeybee removals. According to the Oxford Academy, 1 in every 3 bites of food that you consume every day is made possible by local pollinators. And according to the National Institute of Health, there have been a couple positive studies showing that consuming local honey does in fact help with seasonal allergies. Everybody can support the local bee by consuming local honey. Consuming local honey is good not only for your allergies but also for your cardiovascular health, said Stephanie Scott. Local honey will actually help your allergies if you take a teaspoon in the morning and at night. You'll wake up earlier in the morning and go to sleep easier at night. Another way to support local bees across Georgia is to purchase a bee license plate to support the Georgia Bee Association. This has been your Help Matters Happening. Listen, for more information on local bees, just do your search and you'll find out all the benefits in local bees and how they really impact what the food that we eat. When bees pollinate plants and vegetables and things like that, it helps them to grow, and we need them for that purpose, Jackie. Because if not, we would see a decrease in the foods available, for us to
Wow.
eat.
That's amazing,
Very important.
coach, because everything has a purpose, so don't go killing up the bee.
Let them do what they
Let
do.
them do what they do. Everything has a purpose, and God created it that way. He created everything to fulfill His purpose, and so we have to make sure we're doing the same as well.
Most
So
definitely.
thank you, bees. Just no, I just
The bee nation.
don't disturb them.
Let
Just
them do
like
what
don't
they
kill
do.
all the caterpillars. They turn into butterflies, and so they can further. And I found out not only just the transformation of the butterfly, but before the butterfly even leaves the after it comes out of the cocoon, and it sits there and realizes ready to fly, it lays lava for
Wow. Next generation,
the
huh?
next generation. It
Butterfly.
lays lava for the next caterpillar, for the next butterfly.
Awesome.
So I mean, think about
Let's
that.
talk to our guest because you'll
Okay.
go there
All
and
right,
listen.
guys. We have a special guest in the studio this morning, Help Matters studio this morning. I am so excited to be partnering with this lady and with Augusta University College of Nursing. And I'm just without further ado, we're just going to introduce you to Dr. Lynn from Augusta University College of Nursing. Good morning, Lynn.
Good
Good
morning.
morning.
Good morning, guys. Good morning. So, guys, we're going to be talking about a program that we have. It is already in place. We just still doing recruiting, so you have time to still register. So, guys, I know you're out there. You see the videos and you see the flyers, but Lynn is going to talk a little bit more about and get a little bit more in detail she's very passionate about what she's doing. And so once me and her kind of connected with each other, it's just we just begin to gel, and we have we share similar passions about women's health, and just rural communities and doing things in the community to make our community better.
All right. So, Dr. Lynn, welcome to the show this morning. We're talking about healthy moms, strong women as it pertains to their health. One of the things that Jack and I researched was the percentage, and CDC reported that the National Center for Health Statistics says that percentage of mothers giving birth who receive the diagnosis of diabetes during pregnancy, which is gestational diabetes, increased from 6.0% in 2016 to 8.3% in 2021. So let's just talk to the audience about the diabetes prevention program designed to create healthy women and healthy communities and health equity in rural Georgia. So you got the flow, Dr. Lynn. Talk to us.
Well, thank you, Coach Patrick and Jackie. It just was really a divine meeting to meet Jackie and be able to partner with her in this program. She is all things health, and it's just great to be working with her. So really the vision for the program is really to improve the health of women after pregnancy, and even for women who haven't had children. I can remember as a mom, I really did not spend a lot of time thinking about my health. And now that my children are grown, now I'm having to catch up. And I really want to help women start a little bit earlier. So the women that are really at risk for health problems later on are especially those women with risk factors. Mm-hmm. Women that have had diabetes in pregnancy, we also call that gestational diabetes, they are 7 times more at risk for developing diabetes than just the regular population. Wow. So those women really, I really want to catch them early and teach them and be aware that they are at risk for diabetes. And I think a lot of people in this area, a lot of women in this area have family members that have diabetes. And it's a struggle every day. If you have diabetes, you have to think about it every single time you eat. It's just a really burdensome disease. And so I think if we can make that easier somehow and try to think about it a little bit earlier ahead of time, I'm hoping that will help people that are at risk for diabetes. And unfortunately, there's a lot more obesity in people that are overweight and getting less activity. And I saw the post you had about we sit so much. We sit at our desk and sit and work on the computer. We sit on the couch and look at social media. And we've really got to turn that around. It takes work. It takes effort. And we are here to help women get moving and take care of themselves. And they're taking care of everybody else. They're taking care of their family. They're doing their jobs. Their work is never done, but you've got to take care of yourself. And so we're here to help women take care of themselves.
That's a great point.
That's awesome. Yeah, we're multitaskers. Yeah, I mean, we just built that way by nature, but we pour out and we pour out, but we got to pour into ourselves as well. We have to put ourselves on the top of that priority list as well, because we can't continue to pour and never refill back, so that's so true. And we're multitaskers. And remember the song about Superwoman, we have lives, and we have that that care. We have to care for ourselves. And even where me and Dr. Lynn met, we was at the hub. The Atlanta Public Health came down, and they partnered with us to, we with them, and for the gestational diabetes. And I did not know Georgia, the CSRA was one of the states that have the highest level percentage of gestational diabetes in women.
Hmm.
And that's just like, wow. And that's why it's so important to find out what's going on in your community and what are we doing with our gifts to help support our community and help people better, you
Right,
know.
right. And just to interject a little bit, women are so important to the family. The wives are so important to the family. Women, period, are important to the family, and they bring so much, and women do so much, like you said. But I just wanted to harp a little bit more on self care. It's so important that especially in your rural areas where health equity may be limited, to take advantage of programs when they become available. There are so many programs in the community that people just don't participate in, even though they know that they may need it, even though they know that it may help them. They just don't participate in them. But these programs are brought to these areas, especially the rural areas, to help you, to give you an opportunity to really learn some things about your health and be able to do some things about your health. So now, Dr. Lynn, this program that you and we are participating in. What does the study consist of? What does it consist of? I know it's a diabetes risk screening and health surveys, but what does that look like?
So, what we ask the women to do if they're interested in participating in the program is come to Augusta University for a diabetes screening. So, that in itself is the first step. You need to know where you're at. So, you can have a normal blood test, a normal blood sugar range, which is less than 100. You can be in the pre-diabetes range. We used to call that borderline diabetes, but as the saying goes, either you are or you're not. So pre-diabetes is basically the first stage of diabetes, and so that's sugars that are over 100. And then if you have diabetes, that's over about 125. They keep changing the number. So that is the first step of getting that blood test and knowing where you stand. And that's really helpful to women, even though it might be a little bit scary, of just really being aware of your health. And we do that free. We actually give you a $25 gift card for
Whoa,
coming in. So
whoa,
we have about a half a dozen health surveys, and that really just gives us a better idea of what are some of your health, your health habits. Do you exercise? What kind of things do you eat? Did you breastfeed when you were pregnant? Are you on birth control? All kind of different questions about your health. And the one thing I really am interested in knowing is, how do you perceive your risk of diabetes? Are
hmm,
you really worried about it? Are you maybe just a little bit, or maybe you just don't care at all? And so that really helps me understand where you're at. And everybody is so different, and that is completely fine. We're going to meet you right where you're at, and we just want to help you. We just and I completely confess, when I was a mother, I did not take good care of myself, and I'm here to turn that around. I want women to really take care of themselves and really be aware of their health. And you do not want to be, full blown diabetes when you're older. Believe me, you do not want to have that.
right,
That's
right.
awesome. And I want to back up just a little bit because we talk about the rural communities, because resources is very limited and it becoming more limited for women to get good good quality health. And so Lynn kind of hit on that a little bit, why we just stress out to the rural communities.
So, the biggest problem we face right now with rural communities is the lack of providers and the lack of healthcare access. So, there's been a lot of closures of hospitals in rural areas, and because of that, women aren't able to have their babies in the community. and that puts them at risk. If they have a complication in their pregnancy or with the baby, then it's very dangerous to transfer that mother during labor to a bigger hospital. So, they have to travel far to get maternity care.
Wow.
And maybe if women have a certain illness that they need a specialist, they have to travel far to see a specialist. Telehealth has really bridged that gap a little bit, but when you're pregnant, you need to be seen in person most of the time. And obviously you can't have labor through telehealth. Anyway, a lot of the resources in rural areas, are lacking for health. And we are really trying to reach out to those areas around Augusta, Burke County, Jefferson County, all the counties that actually Augusta has, I believe it's about a dozen counties that we serve as a perinatal center. So we are the center, perinatal center for high risk pregnancies here at Augusta Health. Actually, they call it Wellstar MCG or something like that. They've changed the name. But anyway, we are the center for a lot of women who maybe have a higher risk pregnancy. So we want to really find those resources for you in the rural areas and help you get healthy and help you prevent diabetes.
Awesome. So Lynn, how long is the program? How is the program going to be presented? And this program is not just for pregnant women, correct?
No, actually, we want women to have their babies, and we want to see you after that baby is born. And maybe, it's been 10 years or so since you've had babies. That's fine. Or you haven't had children at all. We just want women that are at risk for developing diabetes. Again, maybe having diabetes in pregnancy, maybe being overweight, having a family history, and so on. So we are going to start March 15th is the big day that we're going to start. But we're going to let women roll in if they still want to join. We will let you join whenever you can come. We'd love to have you. So we're going to start on March 15th. And Superstar Jackie is going to do sessions. And we are going to talk about healthy lifestyle. We're going to talk about eating better, making better choices, making better habits, getting rid of bad habits, trying to move a little bit more. We don't want to use the word diet and exercise. Those are not. Sometimes those are
friendly words.
Yeah, those are not good words. We are going to eat healthy, and we are going to move more, and we are going to become more active and feel better. And we're also going to do some special sessions. We're going to do these sessions about once or twice a month. And then the sessions that Jackie is doing will be once a week, but she'll do those online. So you can catch them anytime. You can catch them live. You can catch them recorded. You can listen to them in your car, whatever you want to do. So we're trying to make this really user-friendly for moms. And we really want to get your feedback. We want to know what works for you and doesn't work for you. So we want to do this together and really come up with a program that's going to work for moms.
Yes, awesome. That's good. And
it's 3 months. I'm sorry, I forgot to say that.
Oh, okay. And so, and then we are making it very, convenient for you. So take advantage of this. I mean, you just don't get this every day. Healthcare is expensive. Mm-hmm. And so when you get a program that is funded and is free to help you better your health, take advantage of this. Education, self-education is very important. So I, wish I would have had something like this, when I was pregnant and, had my kids. But guys, we got to take charge of our health. We got to start owning our health. We really do. And that's my mission. That's my vision. That's my passion, to see women begin to own their health. That means you just taking responsibility. You're becoming you coming accountable. Those things is taking ownership. That means I'm owning it now, and I'm making better choices. I'm moving more,
Right.
So yeah.
And you can't make those better choices without getting some knowledge and wisdom. And then,
Right.
with all things, you have to get an understanding. And that's what this program is going to help you do. Not only is it going to feed you knowledge, not only is it going to give you wisdom, but it's going to help you understand what this is all about. So, Dr. Lynn, we know you got another
Engagement.
appointment or engagement that you have to go to this morning. So let's talk about eligibility real quick, and you can kind of close out with anything else that you want to share with the audience.
Sure. So, like I said, we're gonna catch it after you have that baby. So, even though you might be interested and you're pregnant, just have that baby and wait to join us after you have that baby. So, women that are not pregnant, women that are 18 years or older, up to 50. We have a few women that are a little bit older than 50. And that's okay. We're just trying to keep it in the younger range. So any women that live in Augusta and the surrounding counties, like I said, Burke County, Jefferson County, any county that's considered rural in this area. And if you're not sure, just go ahead and do that registration survey, and I'll let you know. But we're trying to make it available to as many women as we can. And then having a risk factor for diabetes, maybe family history, had it in pregnancy, have high blood pressure, don't move a lot. So pretty much everybody is eligible. So women, it doesn't take a whole lot to qualify for the program. And like I said, we really want to make it available to as many people as we can. And I think the most exciting thing about this program is that we're going to do some special things. So I haven't talked to Jackie about this yet, but we
Uh-oh.
might take a field trip to the farmers market at the hub.
Oh, that is
Yeah, and
good.
so they have a
Yay.
great farmers market in downtown Augusta, and so I think we might make a little field trip over there. And for
Oh,
the
okay.
women that can't go there, they actually have an online farmers market, and we can order fruits and vegetables online, and I'll have those delivered to you. So we're gonna do some fun things, and then another month we have Tasha Coffer she is a postpartum doula. Her organization is honoring the fourth trimester, and she really cares about women staying healthy after pregnancy. And she's going to help us do a self-care session. How do we take care of ourselves? How do we have mental health? We want to be mentally healthy, not just physically healthy. So she's going to do a session. We'll probably do something fun. And then another time, we're going to have an exercise demo from Tori. She owns a business called Fit for Mom, and she's going to do a little demonstration for us in some exercises and trying to get more active. And so we're really going to try to have fun, and we really want this to be a support for each other. So if you feel like you really don't have anybody to talk to about being a mom, or, just struggling with your health, then we really want this to be a support system. And we are here to help you, and we are here to find the resources you need in the community. If we don't know about them, we will find them.
We'll find it for you.
Sounds like a lot of fun.
I'm
Yeah.
excited. I'm
Sounds like
excited.
a lot of
And you get incentives for participating in the program.
Can't
I
beat
mean,
that.
you can't beat that. You don't just let something like this just go and don't participate, and don't assume you know everything. I know we got social media out there. We got our followers and all this, and so we kind of listen to one another, but don't get misinformation, and don't get misinformed, and getting wrong information. We talking about evidence-based information that has been researched to show you how to better take care of yourself, and I love Tasha, she come from the holistic perspective on how to do things. So you getting everything. You're getting the practical and you're also getting the holistic part of it. So guys, if anybody that who would like to be in this program, get the information out there. I will still continue to share on my platform, on Coach and I, our platform, and just putting the information out there. And you guys, we want you, as our listening audience, go ahead and pump this out and push this out in the community.
So real quick, finally, Dr. Lynn, if you want to share any closing statements, please do so, and just make sure that people know who to call, where they can sign up for this program. Of course, you guys can go to getfitwithjackie.net, getfitwithjackie.net, and sign up for the program via our contact us page, or you can give us a call at the number on the screen.
Right. And I think she's going to share the flyer that has my contact information. And there's a QR code to register for the program. And also I can be reached in my office, even though I'm not here most of the time. And that's 706-721-1121. Just leave a message if you want to. And I think the kind of the serious message I want to tell women is that please get healthy now. I have seen too many women with complications of diabetes, and I don't want that to be you. I really want you to be healthy now and for a long, long time. So please take your health seriously. Even if you don't do my program, just please start now taking care of yourself.
Yes, and I support Lynn very much in saying that, because women's OBGYNs, and it's really a lot of OBGYNs are leaving the area, they're retiring, and so I'm telling you, she's right. We got to
Especially in the
take
rural
care of us in
areas.
the rural
Yeah,
areas.
really
We
being
just
impacted.
had one in I forgot the county. Just they're shutting down temporarily. Don't know when they're going to be open. So they left without any medical assistant. Guys, you got to take care of yourself. You got to start owning your wellness. You got to take better care of yourself.
Take advantage of your community programs. All right, Dr. Lynn, thank you so much for joining us on this
Thank
morning.
you. Thank you so much. We're excited. March 15th, we're starting.
Woo! Yeah. All right, guys. That is Dr. Lynn Glenn, Augusta University College of Nursing, guys. So we thank you so much for joining us today and helping us get this information out there. This is March. And so, guys, we're going to be talking about all things nutrition, because March is National Nutrition Month. So we are going to be talking about those things. And so may include some things about diabetes health and diet, and some of the things that we can do to prevent, or if you have diabetes, what are some of the things that we need to avoid, and some things we need to eat more of.
Most definitely. So listen, guys, you got the information for the program. We have another program that you can also sign up for. If you would like to participate in our Healthy Heart Initiative program, you can do that also. That's a 4-month program. We got the information on our website, getfitwithjackie.net, if you would like to participate in our Healthy Heart program. Okay, that's a hypertension program, how we help you to monitor your blood pressure and try to identify the spikes in your blood pressure and what causes that, whether it's food, whether it's stress, or whether it's some type of mental things that are going on. Okay, so if you like to do any programs with us, you can always get us at getfitwithjackie.net, or you can go on our Facebook page, Get Fit with Jackie Fitness, and let us know you're interested in it. We want to thank you for listening to us on this morning. Before I go there, Jackie, you got anything else?
Yes, I want to say yes. It's a blessing to even be able to collab with doctors and be able to bring these things in the community. And that's what God is using us to do, to bridge that gap to our community, from our healthcare professionals to our community. So, and for years I asked God, why you connected me with all these doctors. So I think, and I remember praying, God, connect me with a network of doctors so I can be able to help serve my community and people, and bringing that, bridging that gap. So he has done that. We got free program. You got access to free program. We get them and we bring them to the community. Don't take this stuff for granted, guys. I'm telling you, take advantage of it. Take advantage of it. And I
Yeah.
thank God that he's using Coach and I to be able to get this information and get these free programs out there. A lot of people don't know about all these free programs that are out there that pertains to your health. Any other time you are paying for these things, so hey, if you get a jump start for preventative is awesome. If you can prevent
Yes,
and
sir.
doing these things and joining these programs to do, no charge to you, no money out of your pocket, just your time, your commitment, and your consistency.
That's right. That's right. Anything worth having is you have to put forth some effort
It
in order
is. A
to
dream
get it.
comes with much
Right.
painstaking effort.
Right. And here's the thing, even if you do have these chronic conditions, diabetes, hypertension, cholesterol, things like that, managing is the key. You can manage and you can have a good long life as long as you manage it. Because so many times people don't manage it. So many times people don't even know they have these type of diseases, whether it's diabetes or hypertension or high cholesterol, because they're not doing, like Jackie said, the preventative things. They're not taking the preventative measures in order to know their numbers.
Or
And
they
it's
don't have the resources
don't have the resources,
or
right?
the
And it's
money to be able to
right.
afford
And it's so
some of these
important.
things.
It's so important to know your numbers. Listen, it's been good. We had fun. It's been real this morning. Thank Dr. Lynn again for taking out her time to come on the show. And we want to thank you, the listening audience, for always supporting, for always being there to give someone out there that are listening to us. And we appreciate it, guys. We appreciate it
Yes.
so much. We just want you to like our Facebook page at Get Fit with Jackie Fitness and subscribe to our YouTube channel at Help Matters, Jackie and Coach.
And remember, guys, Still Becoming, a Woman's Journey from Wellness to Wholeness is still available for pre-sale. So go on with www.womenonthewellness.com and get your pre-sale
Get your book.
special. Get your book, guys, because after that, it will go to its regular price on Amazon. Okay. So, guys, it'll be out May the 3rd. So get ready to start your journey from wellness to wholeness, guys. I love you guys. Remember, we're here to help you to become a better you, to be the best you that you can be. We like to leave you with 3 John 2. Beloved, I wish above all things that you may prosper and be in good health, even as your soul prosper. Guys, you have a blessed and a wonderful day.
Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Yeah, let's go.
Health matters to me.
Come on, get up. Cause you tuned into the station for your morning motivation to get your education for your health and your spiritual need.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, no positive attitudes, behavior that's a lifelong dream goal.
Health matters to me.
Yeah, health matters and we're here to help you become the better you, to be the best you, the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.